Coronavirus pandemic has taken the healthcare systems of many countries for a toss, with medical experts now trying to link a rare inflammatory syndrome with the novel coronavirus. The lethal disease is continuing to test the world's capability like never before. But there are some words of relief from the World Health Organization. The World Health Organization has said that the vast majority of children suffering from COVID-19 have mild symptoms and that they will completely recover. However, it was only a small number of children in very few countries who could develop this rare inflammatory syndrome.
But there are some children who have developed severe disease and some children who have died. There are some recent rare descriptions of children in some European countries that have had this inflammatory syndrome, which is similar to the Kawasaki syndrome, but it seems to be very rare. What we've asked for is for the global network of clinicians to be on alert for this and to ensure that they capture information on children systematically so that we could better understand what is occurring in children and so that we could better improve our understanding and guide treatment. But it seems to be very rare and only in maybe 1 or 2 countries so far.
Across Europe, there are but a very few children who have also developed a rare inflammatory syndrome, with swollen arteries and high fever. According to Britain's Pediatric Intensive Care Society, there are 2 possible reasons for this new syndrome. In the first scenario, the illness could be a COVID-19 related syndrome. In the second scenario, the illness could be an unidentified disease. The cases reported were also said to have features of toxic shock syndrome or Kawasaki disease, which is a rare blood vessel disorder. Here's Dr. Russell Weiner in Britain giving us a diagnosis of the rare disease in children.
First, it's important to say that COVID-19 very little affects children. We know that from all countries in the world. That they tend to not get this condition, or if they get it, they have very few symptoms. But very rarely children can get very sick. And our paediatricians in the UK have noticed an unusual condition which looks like a syndrome called Kawasaki disease, which is a type of vasculitis. But it's a condition where children can present with abdominal problems, they can present with neurological problems and seizures, they can present with rashes, essentially, and they can present with shock and collapse. And it seems to be the body's immune system reacting to something and causing this, what we call vasculitis, inflammation of the blood vessels in multiple organs.
Spain is also among the countries that has been asked to watch out for these cases. Cristina Calvo of the Spanish Pediatrics Association has said families should not worry as the inflammatory condition is extremely rare and infrequent. She says it is too early to determine if it is being caused by the coronavirus.
Si estos casos se presentan en nuestro país, también podemos atenderlos sin ningún problema porque tienen un tratamiento conocido. De momento, lo único que se sabe es que se han asociado en el tiempo con la epidemia de COVID-19, pero no está totalmente aclarado si tiene una relación causal o no.
One link is that some of the children who showed symptoms of the Kawasaki illness in Italy also tested positive for COVID-19. Hence, as a precaution, children have been advised to continue the protocol of wearing face masks and practice social distancing. Some doctors claim that the body's immune system is overreacting, which is a symptom of COVID-19. In a significant number of cases reported in Italy, the rare condition believed to be the Kawasaki disease showed resistance to the usual treatments.
It is an acute illness which affects preferentially young children, often below the age of 2, and might involve also infants before the age of 6 months. It's an acute illness which fortunately is rarely fatal, but it is characterized by one complication which is worrisome and can be very dangerous, which is the development of aneurysms, that is dilatation in the coronary arteries.
South Korea has reported 0 domestic coronavirus cases for the very first time since February. The country reported 4 new infections, which were all important. South Korea reported 1 new death, taking the total number of COVID-19 fatalities to 247. The total number of cases in the country is 10,765. South Korean health authorities also confirmed that no local transmission occurred from a parliamentary election which was held earlier this month, where authorities took safety measures, including requiring voters to wear masks and plastic gloves when casting their ballots. The polls witnessed a high voter turnout despite this pandemic. Over 29 million people came out to cast their ballots in the April 15th parliamentary elections. After grappling with the first major outbreak outside China, South Korea has largely managed to bring the outbreak under control without major disruptions, with a massive testing campaign and intensive contact tracing.